Hello everyone, my name is Sherifat Abdsalam. I have my badge, proper attire on. I'm here today to perform head to toe assessment. I have gathered my supply. I have a pen light, gloves and stethoscope. I'll be going into my patient's room right now, provide privacy, knock knock, privacy provided. Then I'll introduce myself to the patient. Hello, my name is Sherifat. I'm going to be your nurse today. May I know your name and date of birth?
My name is Mohammed. My date of birth is 02/04/1968, and I'm giving you my consent to go ahead and do it.
Patient gave consent to perform this assessment. I've performed hand hygiene and then I'm wearing my gloves. So then I'm going to explain the procedure to the patient. What brought you in today, Mr. Mohammed?
I am here for my annual checkup.
All right, patient is here for his annual checkup, and then I'm going to use the opportunity to also perform my mental status exam. Can you tell me what day today is? Today's date?
Today is 15th
15th?
of November 2025.
Okay. Where are you at right now?
Nightingale Hospital.
And then, do you know the current president of the United States of America?
Yes, Donald J. Trump.
Okay. So mental status assessment performed. Patient is alert and oriented ×4. Patient also physical inspection. Patient appears properly groomed, appropriate for his age. The first thing that I'm going to do is to inspect the head. So what I'm going to do, basically for this procedure, is part of your annual checkup. We're going to do your assessment from your head to your toe. What we're trying to do is to find out if there are any issues that the doctor will need to address, since this is your annual checkup. All right, head assessment. Patient does not have any hair on the head, so I'm just assessing for any cut, any bald spot. None is visible. Patient hair is good. Patient also have facial hair which is appropriate and properly groomed. After inspecting the head, I'm going to visually inspect the face. Patient's face appears symmetrical, no issues, and then I'm going to assess the eyes while sitting down so I can be on the same high level with the patient. So for this assessment for the eyes, I'm trying to check if the eyes is symmetrical, and I'm going to do that by using my pen light to check. Mr. Mohammed, you're going to raise your, you're going to keep your head still, but then you're going to follow my pen light. I'm also going to check patient eyes are symmetrical. Patient pupils are round. They are equal, round, and reactive to light and accommodation. Patient sclera is white, and I check the conjunctiva, it's pink. No issues with the patient. And then I'm now going to go further and check the patient's nose. I'm palpating the patient's sinus just to see that the bridge is intact, it's patent, and there are no obstruction. And at the same time, I'm going to ask the patient to raise their head. This way I want to check inside each nerve to check the patency. The nerve is pinkish in color, appears a little bit moist, no dry mucous membrane visible. And then at the same time, I'm going to ask patient to touch their nose because I want to ensure that they are breathing fine. I'm going to touch their nose. You're breathing? You're breathing? For the eyes, I'll have done the Snellen test if it was a proper setting, but at this point I don't have that setting for them to read through. And then after the nose, I'm going to also check the mouth. Lips is pink, tongue is pink. I can see the tonsil. Patient's gag reflex is intact. Patient teeth is complete, no missing tooth. And then patient buccal area is pink and moist, no issues. And then the lips are not dry, they are pink and moist. After that, I'm going to have a visual I'm going to try to do the cranial nerve check. Can you squeeze your face? Frown, smile. All right, cranial nerves are fine for the patient. Now I'm going to check the patient's neck. I'm going to check the lymph node and the trachea. So for the lymph node, it's not swollen. The lymph nodes bilaterally are intact. I'm also checking the trachea. No issues, equal. And then I'm going to have the patient move their head to the left and to the right. Up, down. Patient is, I'm doing this to check the range of motion of patient's neck. Okay, put a little bit of pressure. Okay, patient shoulder stretch is bilaterally is equal. There is no drop in shoulder strength. After this assessment of the face, I'll use the Glasgow Coma scale and try to rate the patient on 15 at the moment, and then I'm going to also check the patient's hair right now. Here, tympanic membrane is dry, there is no drainage, and there is no serum wax. Same thing on the other side, dry, no drainage, no serum wax. I'm going to perform the whisper test. And normally another test that I'm supposed to do is to perform the tuning fork test, but I'm doing this. Can you cover your ears? And I'm going to whisper for the patient. What did I say? Good. Same. What?
24.
Okay, good. Patient hair bilaterally are clear. There is no obstruction. Patient hair is intact and patent. After that, I'm going to inspect the patient's posterior and anterior chest. But for privacy's sake, normally I'll have asked the patient to lift their shirt, but then for privacy, I'm not going to do that right now. So visually, I've inspected the chest. The chest appears symmetrical. There is no bruise. There is no mass observed. There is no bulkiness on the chest. Same thing for the posterior. It's clear, symmetrical. There is no issue. Right now, I'm going to now listen to the lungs. I'm gonna have you breathe in and out. In. This side. No adventitious sound. The lung sound is clear. No wheezing or cracking observed. And then I'm going to do the same at the back. In. In and out. Same thing, no adventitious sound. Lung sound is clear. There is no rhythm. There is no crackles or wheezing heard. And then normally I'm supposed to check the coccyx tail to make sure all the bony prominence are intact. For this purpose, the bony prominence is intact. There is no issue. Do you want to stand for me and turn the back? While at it, I'm also checking the patient back leg bilaterally. I don't see any swelling, no swelling, no edema. Patient's legs appear symmetrical. Do you want to say that? So next thing that I'm going to do after this is I'm going to listen to the heart. for this, I will have done a full 1 minute for the apical pulse, but for the purpose of this assessment, I have done that. And then right now I'm listening to the heartbeat. The S1 and S2 is visible, they are clear, and then the rhythm and rate are regular. No other sounds are heard. The rhythm and rate are regular. At this point, I'm going to discuss the vital signs, which I took earlier before this procedure. Patient's vital signs are within normal range. The temperature is 98.1. I have respiration at 18. Blood pressure is 120/82. I have pulse at 80. Then I have O2 saturation at 98%. Are you in any pain today?
No.
Patient is not in any pain, so pain is 0/10%. So after this, I'm then going to have the patient lie down so that I can check the gastrointestinal, the abdomen. I can have that. Could you please lie down for me? So same thing, if because of privacy, I'm not lifting the chest, but then I'm going to listen to the bowel sound. What was your last bowel movement?
Today.
Is it regular or?
Very regular.
And you're voiding? Do you have any difficulty voiding?
No.
Okay. Patient last BM was recorded. It's self-reported. Voiding is without difficulty. Then I've inspected the stomach. There is no mass, no bulging. Then I want to listen to the 4 quadrants of the abdomen. Patient's abdomen sound is active, no issues with the bowel sound. I'm going to palpate. If it's too hard or if you feel uncomfortable, please let me know. No mass notice, no resistance to the palpitation, no resistance. Patient's abdominal area is patent, no issues with it. Can you wriggle your leg for me? I'm going to try to push forward. Okay, good. Can you roll like a 360? Good. Can you lift your leg up? One leg folded, bend. Same thing for the other side. Up, bend. This one I'm trying to check the musculoskeletal system to make sure that the muscles are not rigid, they are moving, they are not tense. And then can you also raise your hand up? Yeah, patients can also move their hand. Can you get up for me, please? Thank you. So for this one, I also want you to move your heel of your leg up, first side, this side. Can you walk towards the camera and back, maybe 3 steps and back? What I'm doing now is to check the gait, the stability, to make sure the patient have a good gait. Could you sit down? Let me check the reflex. So for this, push it in front of it, yeah. Thank you. Patient's reflex is fine, no issues. And then could you get up and raise your hand? And then give me a range. Patient is performing range of motion, no issues. I'm also using the opportunity to inspect patient's skin, the bony prominences. There are no bruises, no cut. Everything is intact. I also want to check the patient's strength. Could you grab my hand and see? Okay, patients have good grips. There's control of, patient can control their muscles and reflexes. There are no issues. And then can you sit down and let me check the dorsal, the Before then, can I see your hand straight? No. Okay, I can do the strength. All right, patient is strong bilaterally, and I'm going to check the cap refill this way. Cap refill is less than 2 seconds. Patient's nail birds are clean, appropriate for the age. And then I'm going to check the dorsal pedis. Pulse is present, bilateral, no trill, and amplitude is 2 plots. I'm also checking the toes cap refill. Less than 2 seconds, bilaterally. I'm going up to check the femoral side. Same thing, pulse and reading, good. And then I'm looking at the feet. The skin is intact, no edema noticed, no discoloration, cool to touch, it's not warm. Patient feet is fine. I'm also going to, could you put it in there? Can you try to lift your leg? Don't make me move. Okay. Patients also have very good grip of their musculoskeletal system. At this point of the assessment is complete. I've performed, I'm giving a summary of my assessment right now. I've performed the head check, the face, hair, the head, hair, eyes, nose and throat. I've also checked the posterior and anterior chest. I've checked the respiration. I've assessed the cardiovascular side of the patient, and I've also checked the integumentary. The skin is intact, appropriate, patent. I've also checked the gastrointestinal. Patients have regular bowel movement, there's regular bowel sound, head, and I've also checked the upper and lower extremities. There is no edema. I've checked patient strength, patient bilaterally on the upper and lower extremities. The muscles are working. I checked the musculoskeletal by checking the gait and movement of the patient. I also made sure to check the patient whole body from the back. I did a posterior up to the leg. Patient appears okay. At this point, I'm going to provide patient education, but because patient is here for regular checkup, I'm just going to encourage patient to continue to comply with the regular checkup and follow the doctor's orders and continue with the routine checkup. At this point, my assessment is done. I'm going to remove my gloves and then perform hand hygiene, do the necessary documentation, place the patient in a proper position, put the call bell close to the patient. If you have any concerns, please use the call bell. However, the doctor is coming to meet you for your full checkup review. And at this point, do you have any question for me?
No, thank you.
All right. So assessment is complete at this point. I'll leave the patient's room, provide privacy and document. Thank you.